Damn.
Hey, ladies and gentlemen, welcome to another nursing debriefing. Now we're on orientation. We're getting it down, starting another contract, and enjoying the San Diego sun.
100%. 1 month in San Diego. First week of orientation. Matt said 3 days of out of unit stuff, but a little bit of onboarding stuff. So, but low key, I think I mentioned this before. It took us a minute to find this contract and finally landed. As some of you know, that we didn't take the most opportune contract, you could say. We're back on nights. We wanted days, but it is what it is.
We made it happen.
Yeah, made it happen. We're getting paid a good amount, so that's probably the most important part. You could say, obviously, we travel nurses not just because, but a good job of travel nursing is, the monetary value. It's nice.
And I just wanted to say, it's not usually hard getting contracts, days, nights. It's not usually a problem. We're just in a really prime location. Everybody wants to come out here when it's cold. SD is a spot, and this is what creates the issue that we're in, and we had to go on nights.
Yeah, San Diego is amazing. It's my favorite city probably in the United States of America, and I know why it's hard to get a contract here is because it's so nice. But a little bit of background stuff about our onboarding situation that we had. Not a big situation, but it was a little bit of a tedious process, a little bit repetitive. When we landed our contract, we got our physical done. We got a drug test done. We got all our medical stuff cleared and we're good to go. And then we also were getting ready to do some modules because before you go on orientation and do the in-house modules that they usually give you, there's still some out-of-the-house modules. So we did those. We did an EKG test for that. And then we did EKG test for the hospital that we're currently in. We did an EKG test for AMN. Which basically provided our travel agency with this job. And then we also had to do another EKG exam in the hospital. A lot of repetitive stuff, but it's just like a typical onboarding stuff. But it was just a little bit tedious, a little bit long, just because I feel like a lot of stuff was repetitive.
Yeah,
it is what it is.
I wish they could streamline that process a lot better, make it more universal across healthcare. Why are we doing 4 different EKG tests when it shows the same competency? Why can't they look off each other and provide those documentations? And even before, this was one of a long onboarding because I went back to the clinic 3 times back and forth. Make sure you have an N95 from home for you. That's a big thing. That delayed the process where we had to go on Amazon, order an N95. By the way, you have to get reimbursed for that. And wait till that comes, then go get your fit test. This is why I shaved my stubble and got fit tested. But also duplications makes this assignment a little bit more, just like Pete said, tedious because I passed the fit test here. Second day on orientation, I'm getting another fit test. I have a 5 o'clock shadow. Turns out it's a big deal. Now on my tag, it says Papper. But I'm going to still wear a 95 because I'm going to shave a little bit or keep it really just like a stubble. Put some beard oil on there and makes a seal.
That's what you got to do. That's the way you survive, bro. Surviving out here. Just to guys give you a little bit of like a time frame of this. So we signed our contract, I want to say about 2 weeks ago, roughly probably like 14 days ago. That's kind of like what the average signing date to orientation date is kind of. It's like 2 to 3 weeks. We signed our contract and literally our start date was 2 weeks after that. So just if you're curious on how long it takes to find a contract or like when you can land it, and roughly right now the way the industry is 2 to 3 weeks. If you're lucky, you get 4. But before the pandemic, it was a little bit you could say a little bit looser with the time frames, and you could get one a month, 5-6 weeks out. But now it's a little bit tighter with it. But
the hospitals definitely like constricted that window because travel nurses were hopping contracts. So you signed in 1 month, 2 different contracts, you both get accepted, and you kind of weigh your options, see where the better price is, or maybe a better price is there, you take that crisis rate. So that's what was happening. Hospitals made that window, and this is why those 2 weeks are so busy. Just like in football, there's a 2-minute warning. I call it like the 2 week you're in a warning zone where shit's the fan, physical modules, just get it all done, paperwork, signing release forms from your other agency to release medical records, and it's just a bunch of back and forth. Like there was one time Friday night right before the submission, before it started Monday, we had to be home and not grocery shop for 3 hours because we had to get some last minute documentation in. So definitely a lot of sacrifice, but I'm excited to finally start.
Yeah. Before we dive into this orientation, I wanted to mention one thing. If you're going to do travel nursing, or if you're a travel nurse and you're always feeling overwhelmed with the onboarding process, I would highly recommend creating like a folder on your computer, or even using Google Drive to literally store all your medical files, everything like that. So if you go get a physical done, get your MMR booster or whatever, or your titer check for TB, just take a picture of that and save it onto your computer, or save it onto your Google Drive, or even on your phone, because they come. And even your certificates, like for example, your EKG certification, or like your BLS, ACLS, CCR, and all those things, always try and save it to your computer, because sometimes the agency loses things, or emails don't get sent, and you don't want to be scrambling for things last minute. And it's one of those things where if you do it right the first time, you're going to save a lot of time in the future, because every contract requires you to have the same exact things all the time. And if you always have them in one place, you're always going to be prepared, and you're always going to be ready.
Virtual drive for the win.
100%.
And back to that situation, I didn't do that. Just take a picture of it. It works. They'll take it, versus I don't have my one of my serial vaccines or antigens, titers. Now I have to go sign a release form. That's a 48-hour delay. Imagine if we missed that window, you would have to get pushed back another week because you missed a silly document. Why?
And that's a week less of getting
that's
paid.
That's a couple $1,000 if you really want to call it what it is.
Yeah. All right. One more thing before diving into orientation is Matt and I were a little kind of iffy on this contract. We got a phone number to one of the unit managers, and I got to speak to her for a little bit, and she mentioned that travelers are required to flow between hospitals. So we were a little bit worried with that. I asked her for the policy for the requirement, because we're here in San Diego and we only have one car. So obviously, if we get scheduled to a different hospital, like Matt does, and I'm at this regular hospital, then that's an issue, because we have one car. We can't do that. So we were trying to find out more information about that, and we found out in orientation a week later that floating is required. But luckily, the hospital is only 12 minutes away from our home hospital. So that's not that big of an issue. And even our recruiter is really cool. Shout out to him. He said he would cover our Lyft or our Uber drive to that to the location that's not at home, which is solid. So perks of having a really good recruiter. This is why a really good relationship is beneficial for you and the recruiter. And to have, because of little perks like that. Someone so small that, we might go there once in a while, but still you don't have to worry about getting there or paid for, or how are you going to get there. So yeah, take care of a recruiter, and he will take care of you. And
going the extra mile, talk to your manager. If you have the situation like us, hit her up, ask her, listen, this is the situation, we carpool. If I have to float to the hospital, can both of us float there? Just so we could utilize the carpool situation and not have to waste money on Uber. If you explain it and there's multiple travelers, why can't they make that note? It doesn't hurt anybody, versus us struggling and suffering when there's people with individual cars. Yeah. Or if a staff has to go, then you just take their spot, because I guarantee you a staff would want to be at their staffing unit, not the hospital. Yeah. But let's go off the rip here, day one. So day one orientation, we reported to our home hospital. It was a pretty long day. It started at 7:30 in the morning, and it went on till about 8 p.m. That evening. So a little bit tedious, but it is what it is. So we showed up. We got an introduction to one of the educators. Another gentleman came in to explain some of the ethics and why we do certain things at Kaiser, and just kind of that information as like not a prerequisite, but as like an intro to the hospital, what they stand for, a little bit of information about them, all that good stuff, all that jazz. Then we got our badges, reported security, got our pictures taken, made sure our codes work. We got our hospital email. We logged into their system where you could do our modules and get more information, get the protocols. And we went through a PowerPoint. We did glucometer checks. Majority of that time, that 12-hour period that we stayed there for, it was reviewing PowerPoints and then doing modules and just familiarizing ourselves with their equipment. Nothing too wild, typical onboarding, more like an intro to the hospital and like the basic on stuff, glucometer checks, IDs, badges, and just making sure everything works. And this was like the basic pre-COVID nursing orientation, where you did all that bunch of modules. Day two, same thing, modules. You meet and greet your managers from the units, get to kind of understand them, the expectations. And I loved this one because she busted out different events, scenarios, guidelines, action plans that they're working on. So instead of feeling like that one lone wolf you pull up to the unit, you're actually kind of more involved in care and work and understanding what's going on. And the struggles and what they're striving for. Just like they said, communication and no falls. And speaking of falls, that's what blew my mind. Is this is the first contract that I've worked at that they'll dead ass tell you in your face, if your patient falls, you might get fired.
You will get fired.
Those words, I'm like, whoa.
They didn't say you might. Basically said you will get fired.
So no, there's like no fall policy. They don't care. You better take care of your shit. And this is why in scenarios like that you have unions, because you just have abuse from managers, and unions have to become more of a thing. And then kind of going back to day 3, Peter and I knocked out those modules. Day 2, a little hack for you guys. Doing modules, you can double task. So pull up 2 screens, take your Google Chrome or whatever browser, run it to the left on your Windows, and it's going to open up a split screen. You can do 2 modules at the same time and knock them out. Because a lot of times you got that module that you got to click and watch the whole video. That takes a while. You could be clicking on something else. Another awesome thing that this hospital did for us is we did like a scavenger hunt the third day that was majority of the day. Because we're going to be floating a lot, we have 15 different units that we potentially could float on between 2 hospitals. So we went to every single unit and just got to know where things are, making sure access works, the door works. There's a crash cart on every single floor. It becomes very standard, but it's good to know little things and get to know the people that work there. And we did that for both hospitals.
Yeah, and the facility that I worked at, when we walked in the unit to do our scavenger hunt, we started in the ICU, and there's 4 of us, 4 traveling ICU nurses. There's 4 ICU travelers that were in this orientation, and we walked on the unit to ICU to do our scavenger hunt, and we walked in and we saw the board on how much patients there are, and they had 6 patients in their ICU. So and then the nurse manager was saying that there's 60 nurses on nights. 50 nurses on night, something like that, 60 or 50. I forgot what she said, or something like that.
They're well staffed.
It seems like they're well staffed. So they're taking advantage of travel ICU nurses by, not to toot our own horn here, but ICU nurses are, you could say, they work with the most acute. So you could say ICU nurses know a little bit more, and they could kind of spot changes quicker. They're using that to their advantage by hiring ICU nurses and spreading them out throughout the unit. So it seems like we're going to be floating a lot. We even talked to 2 travelers there that we met during the day, and one of them said that she's in the ICU once a week, she said, or 2 times a month or something like that. And the other one says that she gets floated a lot. So definitely prepare myself to get floated. But the nice thing is there's only 4 patients, because there's ratios here. It's amazing. There's only 4 patients. So no 5, no 6, which I'm super glad, because I prefer 2 patients, and I found it very difficult to work with 4. So at least it's reassuring that I'm not going to deal with 5 and 6.
And the reason why we're going to float a lot is this hospital is unionized. We're in California. So they usually, most facilities we worked at, there's a float sheet. So both staff and both travelers are on one sheet, and they switch off dates of who's floating. Very reasonable here. Their ICU staff does not float before the traveler. All the travelers have to float, and then it goes up to the staff. And because of that reason, we're going to just be floating a lot. Yeah. Name of the game.
Right. And then we also asked about the acuity. They don't do CRTs. It seems like a little bit lower acuity, more of like a community kind of hospital, you could say. But like I said, we haven't experienced the whole unit. We just did our little scavenger hunt and just kind of eyeballed it. So we're going to probably find out more next week. So we'll tell you guys a little bit more about it next week. But from what looks of it, it's definitely not the most acute hospital I've ever worked at in my career. It's probably actually one of the lesser acute. Not saying people aren't going to be sick, but like the fact that there's no CRT, then that kind of shows you that they don't take as ill patients, you could say.
And it's kind of cool floating to different hospitals and realizing things. For example, our previous contract didn't have a morgue. Shocked us. We're like, whoa. Coming into this facility, we're like, this doesn't have a cath lab? Whoa. What happens when you have acute MI? So I guess they have a contract with another healthcare system, and they just ship them out anything cardiovascular wise. Yeah. More neuro here.
Yeah, it's interesting. So we'll see how the hospital goes. Like I said, we're floating between 2 hospitals, which would be interesting. We're also floating between different units. So I feel like this is going to be more of like a floating contract first time I'm ever going to have a floating contract technically. So we'll just see how it goes. I'm excited to see what the week brings. And the staff seems cool. Everyone seems very nice, very genuine. It's just very by the book and don't shift out of the book and typical California vibes.
Yes. So if you guys enjoy these, we're going to keep on going and talking about our shift, nursing debriefing after every 3. Join us once a week on these. And thank you for your time.
If you have any questions, drop them down below.
See you on the next one.
Peace.